Good afternoon. Welcome to CHAD's Ask the Expert webinar series. My name is Karen Sampson-Hoffman, and I'd like to welcome you to today's webinar, Strategies for Parenting Children with ADHD in Hispanic Latino Families. This webinar is part of our monthly Ask the Expert series, sponsored by CHAD's National Resource Center on ADHD. As a reminder, today's chat is offered only in English. The National Resource Center is a partnership between CHAD and the Centers for Disease Control and Prevention. Today we are very pleased to welcome our expert, Yamalis Diaz. Dr. Diaz is a licensed clinical psychologist and clinical assistant professor at the New York University Child Study Center. She is a member of the American Psychological Association and the Association for Behavioral and Cognitive Therapies, and has written or co-written a number of journal articles, reports, and chapters related to mental health practice and policy.
Hello, everyone.
Hello, Dr. Diaz. Before we begin the presentation, we have just a few items to explain how we will be using GoToWebinar today. After an initial presentation, Dr. Diaz will be responding to questions from you, our participants. We will only be accepting questions that are submitted in writing through the questions function on the GoToWebinar toolbar. This slide shows a screenshot of where to enter your question. We will not be accepting spoken questions today, either by telephone or through your computer's microphone. If you are participating by telephone and are not online, you will not be able to submit a question. However, you will be able to hear all questions and answers. We will try to get to as many questions as possible during the 30-minute interactive portion of our webinar. Please be sure to only submit questions that deal with today's topic, Strategies for Parenting Children with ADHD in Hispanic Latino Families. Finally, all attendees have been muted, so the only voices you will hear are those of the moderator and Dr. Diaz. If you experience any technical problems, you may call us at the toll-free number on the screen. Unfortunately, this means you will miss part of the webinar, but one of our colleagues here at CHAD will do their best to help resolve the issue. Again, we are very pleased to welcome today's expert, Dr. Yamalis Diaz. Dr. Diaz, if you would like to begin.
Sure. Hi, everyone, and thank you, CHAD, for inviting me to participate, and thank you to the participants for attending the webinar. My goal for today's discussion is really to present some very general information about parenting in Latino families, and then to answer questions focusing on how Latino parents can use effective parenting strategies to manage their child's ADHD while they're maintaining important cultural values. But before we do that, it's very important to keep in mind, first and foremost, that Latinos are a very heterogeneous population with very large variations in country of origin, traditions, values, and beliefs, and that culture, when we talk about culture, we're talking about more than just what ethnic or racial group someone belongs to. Cultural groups are formed by many factors, including things like social address variables, like the neighborhood that you live in, and people can belong to multiple cultural groups. So it's just not possible to make generalizations that apply to all members of any cultural group. But with that in mind, I would like to discuss some very general parenting values that may be common among Latino parents, and we can talk a little bit about how that influences the way they might respond to ADHD. So next slide, please. So when we talk about parenting, particularly when we're talking about parenting of children with ADHD or any behavioral concerns, we have to keep in mind that a parent's specific values and beliefs are very important in determining how that parent might respond to their child's behavior. And we know that parental values and beliefs are influenced by culture, and those help to determine what the parent's expectations are for appropriate child behavior, how parents recognize when there is a problem, and how parents respond to that problem, including using both parenting strategies and any treatment that they might seek. So a couple of, based on research done across different groups of Latino families, we've identified some very general parenting values that really do come into play when we're talking about parenting a child with any behavioral difficulties, and certainly a child with ADHD. So one of those values is the value of respeto, or respect, and the idea of maintaining proper demeanor. So essentially what we have learned from the research among Latino families is that Latino parents may have high expectations for the child to demonstrate respect toward authority and to display behavior that is appropriate across situations. So that's anything from, sort of just doing what's being asked of you the first time to knowing the rules that you're expected to follow while you're sitting in church. And we know that children with ADHD have difficulties with some of those things. The second value that we've learned about Latino families is the value of being bien educado, which literally translates to being well educated, but really what it means is that you demonstrate that your parents have done a good job raising you. So this is sort of the concept of the child's behavior being reflective of the parents. And the last one is the value of familismo, or familism, which is a really, it's a sort of a high value to maintain a cohesive family environment, very extensive family networks, and a lot of interconnectedness between family members. So why this comes into play for a child with ADHD is that parents of children with ADHD may be most distressed, or at least more distressed, when their child's behavior starts to impact their family relationships. So like I just noted, parental values will make a big difference in the way that parents perceive and understand their child's behavior, and as a result, how they respond to that behavior. Next slide. So let's, if we think about it, behavior that is characteristic of ADHD is really inconsistent with the values that I just discussed. And so they may be perceived as inappropriate, disrespectful, or purposeful. And based on these perceptions, if a parent perceives their child's behavior, their child's ADHD behavior, to be disrespectful or purposeful, parents may respond by using increasing levels of discipline, which is unlikely to effectively address that behavior. Because we know that ADHD is a neurological disorder that impacts the child's ability to pay attention and control their activity level and impulses. So let's look at a few examples. One of the ADHD symptoms is that the child doesn't follow through on instructions and fails to finish work. If the parent perceives that difficulty as being disrespectful or not displaying respeto, the parent may respond by putting the child in a timeout or using some other disciplinary action. Another example, the child has difficulty staying seated, as children with ADHD often do. The parent may perceive that as not following the rules that have been explained, and maybe not being bien educado, not demonstrating that the parent is able to control the child in that environment, and the parent may respond using another disciplinary tactic of maybe taking away a privilege. A third example, if the child interrupts a lot or intrudes in the space of others, as again children with ADHD often do, the parent may perceive that as the child being rude and not displaying proper demeanor or knowing how to behave appropriately when the parent is in the middle of a conversation. So the parent may respond by reprimanding the child. Right, so those are just a few examples. Next slide. So developing effective parenting strategies for children with ADHD really begins with understanding the nature of ADHD. So the very first thing that parents can do to develop more effective parenting strategies for children with ADHD is to really try to understand the disorder and how it interferes with the child's ability to complete tasks and do what is expected of them. So for example, how does ADHD make it difficult for your child to get ready in the morning, get ready for bed, complete chores, tasks such as homework, sit at the dinner table, stay seated in school, stay seated at church, wait their turn, standing in line? Sometimes when I rattle off all of these possible situations where the child might have some difficulty, parents will often say that sounds like it's all day long. And in fact, children with ADHD do have difficulty across the day. So we want to understand how ADHD impacts all of these routines and regular sort of daily functioning. And with a better understanding of ADHD, you can then develop good rules, routines, and other parenting strategies to help your child be successful and then minimize the use of sort of disciplinary strategies. So I'll briefly mention a few general strategies parents can use to manage ADHD symptoms, and I'll mention them here just to start the discussion, but won't go into detail, and we can discuss the strategies further in response to participant questions. Next slide. So the very first sort of effective strategy for children with ADHD is to start by really establishing rules and routines, right? Children with ADHD do best when they know exactly what is expected of them and when the instructions that you're giving them are short, direct, and very specific. And routines are particularly important during times that parents might find themselves giving many instructions. For example, in the morning, right? Get dressed, come down for breakfast, do this, do that, or when a child has a lot of difficulty completing the task independently. So this might be morning routines and bedtime routines, and you want to sort of break those down into steps and use other strategies to keep them moving. So we'll talk a little bit about that if participants have questions about that. Next slide. Another really effective parenting strategy for children with ADHD, particularly for managing their problems with attention, is giving good instructions. So although it may seem like sometimes your child is purposely defying you, a lot of their difficulty completing tasks is really related to their problems with attention. So giving good instructions makes it much more likely that your child can do what it is you're asking them to do. And so sometimes what parents will say is that the child is not doing what I'm asking them to do. I tell them to go put their shoes on, I tell them to get their backpack, et cetera, et cetera. And sometimes I will point out to parents that perhaps the child simply got distracted on the way to doing the task, or did not process it, or was very inattentive while the parent was giving the instructions to begin with. So this is an important piece of sort of helping your child to complete tasks despite their problems with attention. Next slide. And lastly, and although there are many parenting strategies that we can recommend, I'm going to sort of cover these top three. We know that children with ADHD, just by virtue of the kinds of behaviors that they display, really receive a lot of negative and corrective feedback for their behavior throughout the day. So it's really important to ensure that you maintain a positive relationship with your child and to sort of minimize the impact of their on their self-esteem of that much negative or corrective feedback. So we highly recommend that you use praise frequently for everything that you catch them doing well, particularly for things that your child typically has difficulty with. So if your child has a lot of difficulty staying seated at the dinner table, then for the 10 seconds that they're sitting there, you might want to say, I really like when you're sitting at the dinner table with us. It makes it really pleasant to have you here, or whatever your sort of natural style might be. And then on the sort of other side of that is to choose your battles and simply ignore minor misbehaviors, complaining, whining, throwing tantrums. When you're ignoring your child, you just take away attention from some of those minor behaviors that the child might display. Next slide. A quick note about physical discipline, which is still commonly used by parents from many cultural backgrounds, certainly not just Latino parents, but just a sort of quick note for reasons to avoid physical discipline. Again, if parents believe that their child's ADHD behavior is disrespectful and purposeful, they may be more likely to use something like physical discipline to address it, right? So increasing levels of firm discipline. But we really want you to keep in mind that if your child's behavior is difficult to manage, you may end up using physical discipline far too frequently, and it may also escalate. It's a short-term solution. It may stop the behavior in the moment, but it doesn't necessarily teach the child an alternative behavior. It can lead to higher levels of aggression and hostility, and it can certainly lead to child injury and or involvement of social services. So, the other thing about physical discipline is that we have to really keep in mind, and again, this goes back to understanding the nature of ADHD, that this is, in fact, a neurological disorder that your child struggles with, and so physical discipline just doesn't teach them the skills and competencies that they need to sort of contend with the ADHD over their lifetime. So lastly, next slide. I just want to make a quick note about who else can help you to get some help for your child in managing their ADHD. First, you might want to consider seeing a behavioral psychologist who can help you develop very specific parenting strategies for managing the child's behavior. Your child's pediatrician or psychiatrist can certainly discuss the possibility of using medication, which oftentimes a lot of parents, but certainly parents of Latino backgrounds, may be very hesitant to use medication, but I always recommend that you at least have the conversation, because we do know that medication and behavior modification are the two most well-supported treatments for ADHD. And lastly, your child's teacher or school can help you to get special accommodations for your child to help them be more successful academically. And collaborating with your child's school is very essential to your child's academic progress. Okay, so next slide. At this point, I am happy to open it up for questions.
Wonderful. Thank you, Dr. Diaz. Our first question today comes from Mia, and Mia asks, because respeto is so important, what are some suggestions for how to communicate with teachers regarding a child's discipline?
Well, that's an excellent question. You know, one of the things as far as sort of communicating with teachers about both your expectations for your child's behavior and what kinds of messages you're trying to send your child about their behavior is to really communicate with the teacher about what it is you'd like your child to be doing a little bit differently. So rather than discussing with the teacher what you don't want your child to do or what you are working on at home, you might want to say, I'd really like to see my child doing X in the classroom. How can we work together to make that possible? And also communicating with the teacher what it is you're trying to teach your child by using certain strategies. So if respeto is part of what you're trying to teach your child, you want the teacher to understand ways that he or she might be able to help you develop that value. And I'm not sure if we're able to get some additional clarification. I hope that answers the question.
I think it does. I think that was very helpful. Thank you. Our next question is from Amy, and Amy asks, how do you suggest I find a treatment professional who really understands ADHD? I think this is a question a lot of parents ask, especially when there are cultural concerns.
Absolutely. So I think the very first thing, and that's part of the reason that I put in the slide, that a behavioral psychologist really will be, you know, one of the types of psychologists that will be most helpful in being able to develop a behavior modification program addressing your child's behavior at home and at school. So sometimes what I recommend is that, especially if insurance, if you want the provider to be covered by your insurance company, is to contact the insurance company and ask for a list of providers, and then to contact the provider directly and ask two important questions. The first one being, what type of treatment do you provide? Meaning, do you provide behavioral treatment for, you know, for different child behavior problems? And number two, how much experience do you have working with children who have ADHD specifically? And I think by answering both of those questions, you'll probably get a pretty good sense of whether or not the provider can help to address that. With the cultural piece, I think sometimes we assume that general providers who are not necessarily of Latino background or have a lot of experience working cross-culturally may not be able to work with families that are diverse. I think you really want to start from the behavioral perspective and then see whether or not that provider fits with your style and makes you feel comfortable in the room. Next question. Karen, I'm ready for the next question.
Thank you. Our next question comes from Andrea, and Andrea asks, what can you suggest when both parents have ADHD and have difficulty being consistent and maintaining consistency in the home?
Well, this is definitely a question that I get often, not only when the parents have ADHD, but certainly just in terms of keeping the approach to managing the child's behavior consistent across parents. So that's sort of a twofold question. Let's start with the consistency part of things. It is very difficult for parents to kind of feel like they're on the same page when they're responding to behaviors. One of the ways that you can most easily come to the same page and sort of establish a consistent approach for managing the child's behavior is to sort of organize yourselves around target behaviors. So what I mean by that is if we decide that we're really working on the child's compliance, ability to follow through on tasks and instructions, and you decide exactly how you're going to respond to your child's compliance and non-compliance, then both of you are sort of, you develop a plan, you know exactly what strategies you're going to use, and so when you see that your child is complying or that your child is not complying, you know exactly what to do because you've already decided that that's how you're going to respond. So it kind of organizes parents around very specific behaviors that they'd like to work on, and allows them to develop a more consistent approach for those particular behaviors. As a sort of side effect of that, parents will then start to notice that they're developing a little bit more consistency across the board, not just for those behaviors. So that's sort of part one. Part two is this sort of concern about parents having ADHD, and whether it's one parent or both parents. Parental ADHD certainly, makes it a little bit more complex, just because parents themselves will have difficulty monitoring or staying on top of things, or being very attentive to certain, maybe even helping with the child with homework. Helping the child with homework, for example, might be a little bit more difficult for parents who have ADHD themselves. Staying organized and helping the child be able to complete tasks that are multi-step may be difficult for parents who have ADHD. And so one of the things that I often recommend is that parents sort of really do a little bit of self-assessment in terms of how their ADHD impacts their parenting, the ability to monitor certain things that their child is doing, the ability to follow through on certain things, and to develop very specific strategies just around those particular difficult times. So it sort of organizes the parent, and the parent can then remain organized in their parenting approach for the child's behavior. Next question.
Our next question comes from Wendy, and Wendy asks, if misbehaviors are constant, is there a way to address the issues without using timeouts? What is a good way of correcting misbehavior while understanding that ADHD could be a factor?
This is a very good question, in particular with regard to using very frequent timeouts. I think if you're using a lot of timeouts, or you find yourself responding to behavior using a lot of discipline, it's probably a good sign that the, number one, that the discipline approach is not working for that particular behavior. And number two, it's probably a really good sign that the child's ADHD is in fact playing a pretty significant role, because no matter how many timeouts you give, the child is still struggling with whatever task you're asking them to do. So one of the things, going back to one of the points I made earlier about praising and ignoring, is to really think through the positive behaviors that you would like to sort of focus on and catch your child doing. One of the things we often recommend is that you find the positive opposite of your child's difficult behaviors. So for example, if your child often uses a really loud tone of voice in the house and seems to always be shouting or yelling, or just has a very loud presence, the positive opposite of that is that they use an appropriate tone of voice, an indoor voice, if you will. If your child has difficulty completing tasks from start to finish, or doing it the first time you ask, then the positive opposite of that is that they did it the first time you asked, or that they started moving as soon as you asked. So you always want to think about, what does my child have some difficulty with? What's the positive opposite of that? And how can I begin to shape up those behaviors by providing a lot of praise and positive feedback, and in some cases rewards for doing those positive behaviors? So that's sort of step one. And step two is to really think through, which behaviors do I find myself responding to the most, and how many of those behaviors can in fact be either ignored because they're not destructive, they're not aggressive, it's not the biggest thing I have to worry about, they're just minor misbehaviors like complaining, whining. Sometimes talking back is lower on the sort of priority list. You might come back around to it at some point, but it might be lower on the priority list for now. And so really thinking through which behaviors you can ignore and which behaviors you can praise might actually reduce how much time you're spending just responding to negative behavior using timeouts. So that's just kind of one place to start. But certainly if you're finding that things are escalating or you're finding you're always giving timeouts or timeouts are not working, that is also another sign that you might need just a little bit of help from a behavioral psychologist or some professional to kind of help you tweak the parenting strategies that you're using to make them more effective. Next question.
Thank you, Dr. Diaz. Our next question comes from Carmen. She asks, how many times should you ask a child with ADHD to do something if they refuse to comply at first?
This is another really good question, and parents will often complain that they find themselves repeating themselves over and over and over again. And what we want to do is both understand the child's ADHD. Yes, they have inattention. Yes, they have difficulties following through on instructions. And while understanding the child's deficits, we also don't want to get into a habit where we're repeating ourselves so much that we're essentially teaching the child that they've got at least a few freebies before they actually have to start moving. So we really don't recommend that you repeat instructions more than once and then follow it up with some sort of, sort of prompt or warning or reminder, right? So using what we call an if-then statement might be a more effective approach, right? So the first instruction might be, please start your homework. You give the child an opportunity to start moving toward the direction of the homework table, and when they're not moving, then you might say something like, if you don't start your homework now, then you won't be able to watch TV at 7 o'clock. You'll have to wait until you're done with your homework, for example. So just kind of reminding the child, rather than repeating the instruction right in that moment, please come to the table. Please start your homework. Please come to the table. How many times do I have to ask you? Please come to the table. So rather than getting into that repetitive routine, you just go straight to an if-then statement. If you don't, then you won't be able to do X. And then also using what we call a when-then statement. And a when-then statement is essentially when you finish your homework, then you may watch TV. The nice thing about that is that it makes the sort of pleasant activity they're looking forward to contingent on finishing the thing that they don't want to do. So the sort of more focused answer to that question is that you really don't want to repeat instructions more than once, and certainly unless you thought the child really didn't hear it, then maybe you might repeat it a second time. Good question. Next question.
Thank you. Our next question comes from Pedro, and he asks, do you think primary care providers are more important than specialists in managing ADHD in Latino children?
I'm sorry, can you repeat the question? Karen, can you repeat the question?
I am so sorry. Yes, of course. Our question comes from Pedro, and the question is, do you think primary care providers are more important than specialists in managing ADHD in Latino children?
That's actually a very good question. I think it depends. Primary care providers can absolutely be sort of a first-line provider for many families of children with ADHD. Certainly for Latino families, they often are the first-line providers and may be able to manage, the ADHD medication, for the lifetime. So they are an absolutely essential component of treatment, particularly for Latino families and certainly for lower income families. As far as managing the ADHD as a whole, I think they probably are only able to really manage the medication and don't necessarily provide the other half of treatment, which is so essential, and that's the behavior modification and the behavioral assistance that the parents need both at home and behavioral school consultation for getting accommodations at school. So they're definitely a first-line provider and can be a really valuable resource, and can also then help connect Latino families to other providers. Next question.
Thank you. Our next question comes from Maria, and the question is, what barriers have you seen with Hispanic Latino parents accepting ADHD as a real medical diagnosis? This can be a problem for many families, and it is a cross-cultural problem.
So the short answer to that question is there are many barriers to sort of accepting the ADHD diagnosis among many Latino parents and families. Probably not just because, certainly not specific to ADHD, but really across mental health problems and different diagnoses. But sometimes I definitely feel like it's even more so with ADHD and behavior problems because it feels to them like it's a parenting issue and it's a discipline issue. And this is the reason that I started the discussion. We're talking a little bit about perceptions of behavior and how parents may then respond. Because if you don't accept that it's an actual neurological disorder, that the child actually does have deficits that make it harder for them to do these things, or the things that we expect them to do, or to attend in school, or to complete homework, get started, all of the things that children with ADHD really struggle with, if you really don't accept that it's a neurological problem, then the way that you respond is going to be focused around things like discipline and other kinds of maybe dietary changes, etc., and maybe not so much focused on getting treatment or accommodating the child's ADHD and understanding how it plays a role in day-to-day. But it's definitely one of the most significant barriers to Latino families getting treatment for ADHD is just not feeling like treatment is going to be helpful or effective, or that even the behavior warrants treatment. It's almost like a foreign concept at times. So this is something I've heard from many families cross-culturally, but certainly from many Latino families as well. So that's a pretty significant barrier. And in fact is really one of the reasons that I myself and many other providers and researchers do these kinds of talks and presentations, is really just to try to help educate the families about the kinds of problems that children with ADHD struggle with and why treatment and getting treatment, etc., is so essential. Good question. Next question.
Thank you. Our next question comes from Yolanda, and she asks, what would you say to other family members who do not agree with your parenting style when your child has ADHD? How do you communicate with other family members who may not have the same understanding of ADHD as a parent does?
Well, this is a really tough position to be in for a lot of parents. And earlier when I mentioned the concept of familismo or familism, this is when I hear it the most from families, is that they feel like extended family members don't understand their child and don't understand that their child has ADHD. And so therefore they don't understand their parenting approach, and maybe the parent ends up feeling criticized. And I think as a result of both of those things, it ends up just kind of straining family relationships, and this can be really distressing to families that feel very connected to their extended family members. So I think one of the ways that I often try to explain it to family members, or when I'm working with a family who says, I don't know how to explain this to my mother who lives with us or comes over frequently and doesn't understand why my child behaves the way they do and why I address it the way that I do, is to really just chip away at the understanding of the ADHD by sort of educating them about what it means to have ADHD on a very, very basic level. And by basic, I mean rather than saying, my child has problems paying attention, you might say, so when I tell my son to do something, he's only processes about 10 of the words out of the 20 that I said. That's I can't say that I know how many words children with ADHD actually process, but I think for somebody who doesn't understand ADHD, if you were to tell them in those kinds of terms, he only processes this much, his attention capacity is much smaller than mine. You know, what I just said to you, you heard this entire sentence. My child can only really process and maintain this amount of information. Their body feels like it needs to move all of the time, so while you and I are sitting here enjoying this conversation, my child will be having a lot of trouble staying seated. So really thinking through all of the behaviors that your child has difficulty with and trying to frame it in ways that family members and folks who just don't understand ADHD can really wrap their mind around, so that instead of criticizing the child, they can begin to understand and hopefully even empathize with how difficult it is for the child to contend with ADHD at times. So I hope that helps. Next question.
I think it does help. I think that was very helpful. Our next question comes from Angie, and she asks, can you elaborate more on what familismo is and how ADHD impacts this value?
So that's another really good question. It's not so much that ADHD impacts the value per se, but familismo is a sort of large value that we've seen not only in Latino cultures and Latino families, by the way, but in cultures that are known to be what we call collectivist. Collectivist cultures are essentially cultures that believe that the family is sort of the center. And family members are organized highly and heavily around the family and loyalty to the family, and you know, everybody sort of collectively, for you kind of to tie it to the collectivist culture concept, they collectively work toward the better, the sort of the good of the family, if you will. And so how this ends up playing a role with families that have ADHD is that the child with ADHD their behavior may be so difficult to manage at times, or just really violate a lot of the expectations that other family members may have. And as a result of that, it ends up straining the family relationships. And what I've heard from parents is that they, you know, will say things like, my child and I have stopped being invited to, you know, our aunt's house because my aunt is, you know, she's constantly criticizing how my child behaves, and her children are so well behaved and mine is not. And these are the kinds of things that I'll hear from parents, that they feel that they're beginning to be isolated, that they feel criticized by family members. So maybe the family members don't necessarily isolate them, but maybe they themselves feel like they can't. I just heard from a parent the other day that they very rarely take their child to many functions because they're just afraid of being embarrassed by their child's behavior. So they've started to isolate and withdraw a little bit. So that's kind of how a child with ADHD or a child with any behavioral issues may start to impact the family fabric, if you will. And so that's how it ties to this concept of familismo in Latino families. Next question.
Yes, thank you very much. Our next question comes from Katya, and she asks, what can Latino families do if teachers or the school do not understand ADHD?
Oh boy, that's a big one. That's a really great question. I actually do a lot of behavioral school consultation myself, and often find that one of the most difficult pieces of what I'm trying to do is to have teachers not only understand how ADHD is really playing out, like moment to moment, right? Again, kind of going back to the point earlier about explaining it to family members. The same thing happens with teachers who, you know, I have to say teachers have a very, very difficult job. They have a lot of kids, and they have, you know, sort of low budgets, et cetera, right? We could go on a whole tangent as far as schools and handling children with different concerns. So they have a lot to contend with, and yet one of the things we're trying to do is help them understand how ADHD impacts the child's ability to meet all of the expectations that are being that are expected of them, right? So everything from being able to stay seated throughout the lesson, to raising their hand before they speak, to completing the work in the time allotted, to making it neat when they do it. All of those things are things that teachers are sort of consistently frustrated by. And so this is really the same thing that needs to happen, is whether the teacher understands it or not. I think parents really need to become their child's best advocate in insisting that certain accommodations be put in place. So something as simple as giving the child scheduled movement breaks, rather than expecting that the child stay seated the entire math lesson, when we know that every day during math the child is wiggling in their seat and then up they go, and now they're getting in trouble for that. We can sort of head that off a little bit by just putting a movement pass in place, right? So the child gets to request 2 movement breaks throughout the morning period that last a minute. This might be just enough to reset them. That's just one of many, many, many ways that teachers can respond to the child that has ADHD in the most effective way to just minimize how much negative feedback that child is getting throughout the day. So again, parents, what they can really do is they can become educated about ADHD, become educated about educational rights that children with ADHD have, and they can be in constant communication, very positive communication, right? Because you definitely get further when you're collaborating with the teacher rather than going in and sort of demanding or telling the teacher how to handle it. But to really collaborate with the teacher around understanding your child and things that the teacher can do that won't take up much of their time or effort to help your child be the most successful in the classroom. And again, if this is something that you're really struggling with and the child is having a lot of difficulty in school, then getting some assistance with either a behavioral school consultant, a psychologist that does behavioral school consultation, an educational advocate. There's a number of professionals that can help with some of that if it's becoming an issue. Next question.
Thank you. Our next question comes from Carolyn, and she asks, can you give advice for parents who do not have health insurance? How can they find the help they need for their child? And this, I think, is a question for many parents.
Absolutely. There's a number of ways that uninsured families can get help. The very first thing that you can do is start at your child's school. And oftentimes for uninsured or low-income families, a really good place to start is to connect with your child's school counselor or to talk with the school about any services that are available. So oftentimes what you might find is that there are programs developed specifically to help parents access the resources that are available to them. Many schools have what are called parent advocates or parent ombudsmen or different sort of parent consultants that are specifically there who have been trained to help parents access the kind of resources that they need. So the very first place you might start is to go to the child's school and say, this is what I'm noticing, this is what I think we're having trouble with. Can you tell me if there are any services available here, what services are available in the community? So schools are a good place to start. The other place that you might start, believe it or not, is if there's a local university nearby, wherever you happen to be. If there's a university that has a Department of Psychology, you might want to contact the Department of Psychology. They often have training clinics or clinics where their students are training to become psychologists essentially, and can often provide very low cost services, and in some cases free services. And in addition to providing services through the clinic, a lot of universities have research studies that are free of charge to the families, really because we're trying to do research to kind of learn about different families. That might be another avenue to get treatment that is free to the family. And then lastly, you might want to speak with your child's pediatrician about any available services in the community. Oftentimes when people are recruiting for new services or anything that's being developed, they will target the pediatricians to get the word out to families. So those are all ways that uninsured families can try to access services that are available that they're just not aware of. Next question.
Thank you. Our next question comes from Elena, and she wants to know, what advice do you have for dealing with extremely impulsive children? How do you help the child who does it and then thinks about it?
This is right. This is a classic ADHD sort of concern. It's one of the problems with ADHD is poor impulse control. the good news in the question that I just heard is that it sounds like the child does something and then thinks about it, which to me suggests that the child is starting to develop, it's the link between their impulse and the action is starting to get shorter and shorter. And what I mean by that, when we talk about impulse control problems, essentially what we're talking about is a child having the impulse to do something, and it goes from impulse to action before the child has had a chance to make a decision, if you will, about whether or not to follow through on that behavior. And for somebody without ADHD, our brain actually does some of the work for us, very quickly processes what the context is, where am I, is this okay, is this not okay, what are the consequences of this behavior, and our brain does some of that quick processing for us. Somebody with ADHD has a sort of a delayed processing of context, environment, and possible consequences. So it goes from impulse to action much more quickly. What you can do to kind of start training some of that for your child is in situations where you're able to, like for example, if you're going to ask your child a question about something that they may be impulsively likely to lie about, you might want to introduce like a quick second for them to think about it by asking the question and then very quickly interrupting their answer and saying, before you answer me, please think about your answer, because if you tell me the truth, this will be the consequence. If you tell me something that's not true, this other thing will be the consequence. And by doing that, you actually just increase the delay between the impulse and their response. So that's just one example of kind of like training some of the impulse control. But the other thing that you can do is just to really think about the behaviors that your child engages in that are impulsive. And you may want to establish a few general house rules that are intended to for the child to then know what the rule is, and then there's going to be an immediate consequence for violating that rule. For example, if the child impulsively breaks things when they're really upset, or impulsively hits or kicks when something is upsetting to them, every time that behavior is followed with a negative consequence, you get a little bit closer to training their impulse control and the ability to inhibit that impulse. I hope that's clear, but I hope that answers the question. So you really just want to keep catching it as the behaviors occur. And certainly if you catch the child catching themselves, you really want to praise that. I just saw a child yesterday just start to interrupt, and then he put his hand over his mouth. And as soon as I saw that, I went over and I said, I saw that you caught yourself right before you interrupted. Really nice job waiting your turn to talk. So you want to catch them catching themselves if you can. That's another way to sort of help them recognize that they're doing well with that. Next question.
Wonderful. Thank you so much. Our next question comes from Marco, and he asks, are girls with ADHD treated differently than boys in Hispanic Latino communities? And are girls less likely to be diagnosed and treated?
Yes and yes. Those are the short answers to both of those questions. So the first part is whether or not they're more likely to be treated differently. I think the answer, and I'm not sure that we have necessarily a whole ton of research to support just my sort of clinical experience and my understanding of ADHD in sort of how it's perceived in Latino families. But if you think about the expectations for a girl, in Latino families, if a family or a parent is really adhering to certain gender sort of stereotypes or gender expectations, gender-specific expectations, like that the girl will you sort of behave a little bit appropriately, running and jumping might be less appropriate, staying seated, really being very respectful, sort of the typical, we would consider like very ladylike behavior, if you will, for lack of a better term. If a parent really adheres to that kind of gender-specific, sort of perspective, then if a girl with ADHD is very hyperactive and impulsive, she will be violating those expectations. And so as a result of that, the parent may respond very strongly. Whereas in many cases, what we find is that for boys who are very hyperactive and impulsive, many parents, and certainly many Latino parents, but this is true about many parents from many cultural backgrounds, will say that's just a boy being a boy. So the threshold for the ADHD behavior among boys is a little bit higher, and it might be lower for girls. But the other thing is that girls, we know, are often maybe a little bit more on the inattentive side of things, and sometimes don't display as much of the hyperactivity and impulsivity as we see in boys. And so because of that, they may be less likely to be identified and certainly less likely to get treatment. And if they are displaying hyperactivity and impulsivity, then again, as I discussed earlier, it might not be perceived as a problem that has anything to do with a mental health disorder. So the likelihood that they're going to then go get treatment is even lower if it's just perceived as the girl, as being rude or disrespectful. So that's definitely one of the things that can interfere with girls in Latino communities getting treatment. Great, really great question. Next question.
All right, we have 2 more questions for today. The first of our last questions comes from Jesus, and he asks, what are suggestions for helping parents overcome a fear of medication? ADHD, as you know, is managed multimodally through education, behavior management, and medication when appropriate. How do you help parents make the medication decision?
This is a really tricky one because we know that in many Latino families and communities, the fear of putting their child on medication really stems from a lot of myths about the effects of medication, and they tend to be very hesitant to try medication. The way that I often discuss medication options with any family that is really resistant, and certainly with the Latino families that I've worked with, is by continuing to point out all of the things that ADHD is impacting in their child. And so I sort of call this just kind of tying the treatment to the parent's specific goals and sort of desires for their child, right? So really helping the parent recognize how ADHD is impacting their child negatively. So if we've gotten to a point where we're discussing medication, and the parent is saying, I really feel strongly that medication is not for us, the first thing I want to do is I want to understand what they know and what they've heard about medication, because that will give me the opportunity to kind of debunk any myths that they might believe they're not true. Like, for example, that the child might become addicted to medication, right? So I can debunk those myths if I know them. The second thing I'll do is I will help them really start to think about the ways that ADHD is interfering with their child's academic functioning, their child's ability to develop friendships, anything that it's impacting. And really start to talk about ways that the medication can be helpful. And then if nothing else, I can sort of point out that a lot of the medications for ADHD are in and out, and so a trial certainly wouldn't have any long-term effects, and it would be it would be worth at least trying it. So this is a very sensitive conversation that you often have to have with parents, but I think tying it to their goals for their child and really helping them understand how ADHD is impacting the child's ability to meet those goals is one way to put it in perspective for them, if you will. And of course, we can't force them to do it, but we can at least try to make it a little more likely that they would be willing to give it a try. Next question.
Wonderful. We've reached our last question, and it's from Katya. And she asks, are there advocacy groups out there where families can get support and help in Spanish?
So that's actually it really depends on where they are, but I do think let's just start with sort of where we are right now. Certainly CHAD is always, believe it or not, and I promise I'm not just saying this because I'm doing a webinar for CHAD, but I actually always recommend that parents start by visiting the CHAD website and or calling some of the sort of phone numbers and different helplines that CHAD has available, mainly because I think that CHAD provides a lot of information in Spanish and can also point parents toward regional or sort of area-specific advocacy groups and different organizations that might be able to help them in their area, since it is a national organization. But the other thing that parents again can do is think very sort of carefully about what is in their area. They can start by asking at the again, calling the local university psychology department and asking if they know of any advocacy groups for ADHD services or any kinds of mental health services in Spanish. They can visit the community mental health clinic or call the mental health clinic and ask about any services available. They can certainly check in with schools. So really just kind of checking in with organizations that are already embedded in the community and finding and sort of going from there. So that was our last question, I believe.
That was our last question. We would like to thank you for taking your time to be with us today, Dr. Diaz, and we'd also like to thank our participants for making the time to be here with us. This has been an informative and thought-provoking experience for our participants.
Great. Thank you so much for the opportunity to participate.
Thank you. To our audience, if you have any additional questions that Dr. Diaz was unable to get to today, please give us a call at the National Resource Center on ADHD, and our phone number is 1-800-233-4050 to speak with one of our health information specialists. And one of our health information specialists can talk with you or a family member in Spanish if you would prefer. We are very happy to have had you today, Dr. Diaz, and we would also like to let our participants know that CHAD's Parent-to-Parent Family Training Program on ADHD will be launching a program in Spanish. Parent-to-Parent is looking for bilingual parents to become teachers for the parenting class. The first training will be in San Jose, California in September. There is no cost. For more information, if you are interested in being one of our bilingual teachers, please send an email to parent-to-parent at parent@chadd.net. The date and topic for our next webinar will be announced shortly on our website at www.help4adhd.org. Thank you for participating in this presentation, and to our participants and to Dr. Diaz, please enjoy the rest of your day. This concludes our webinar.